Next, we're going to do some basic examination procedures for glenohumeral external and internal rotation. So Hannah, would you please put your arms like this and outwardly rotate as far as you can, okay? Okay. Visually looking at that, that looks like pretty nice external rotation on the right, limited external rotation on the left. And again, I'm going to ask the patient, what's stopping you from going further? Does that feel painful? If so, I'm going to apply an overpressure test. And that's just one additional passive movement. At the end of her available active motion, and we determine whether or not that causes pain. If it does, in fact, cause discomfort, at that point in the examination, you have to clarify. Where was the discomfort? What's the character of the discomfort? Is it sharp? Is it dull? You might also want to ask the patient, what's the intensity of the discomfort on a 0 through 10 scale with respect to that limited external rotation. So externally rotate as far as you can and go to that restricted point. If Hannah tells me that it just feels stiff, I can't go any farther, again, I'm going to hold right at her elbow and just proximal to her wrist. Come out of external just a little bit so I don't miss the first stop in the movement. And I'm going to repetitively test with a passive motion the first and final stop. And this is called end feel testing. And I want to know if that stops early and feels firm. If it does, we're likely dealing with some element of capsular shortening. Okay? Just to make sure there's not a weakness impairment limiting Hannah's external rotation, I'm going to ask you to hold now. Don't let me move you. And I'm going to test the dorsal portion, the posterior portion of her rotator cuff, infraspinatus, teres minor, and to a certain extent posterior deltoid, to see if any of those muscles are weak, limiting her external rotation. So let's look at internal next. Okay? Can you bring your arms out just a little bit and then rotate them downward this way? Okay? And let's say for the sake of discussion, this seems, again, a little bit restricted. If she seems like this is limited by discomfort, one additional push at the end of her available active motion, that's called an overpressure. If that's painful, I'm going to clarify location, intensity, character of discomfort. If it feels restricted to her, I'm going to take her out of internal rotation a little and repetitively test the internal rotation end feel, like this. Again, if the stop in internal rotation comes early and feels firm, we're likely dealing with some element of capsular shortening. I'm going to bring you down just a little bit like that. Okay. Now I want you to hold, not let me move you. And let's test the strength of those internal rotators. Okay. Remember, visually, if any movement appears restricted, it's our job to measure it with a goniometer. It's probably best to take your formal goniometric measurements of shoulder external and internal rotation in supine with a standard goniometer. So Hannah, if you would lie supine just for a moment. Okay. Clinically, if you're dealing with a sore shoulder, you want to support that shoulder in the resting position during this testing process. It's not okay to take a sore shoulder and test it down here on the table. Bring it up in the most likely comfortable position. It's a little bit closer to the resting position. And then just do your best with goniometric measurement. Hannah's internal rotation is restricted right there. That's as far as she can go. Get the axis somewhere around the olecranon process. Be pretty consistent. Keep your stationary arm vertical and measure the internal rotation. Again, keep the arm supported in a comfortable position. I'm using my leg to do so. Say for the sake of discussion, Hannah's external rotation is limited there. Again, I'm trying to support her arm in a comfortable position. Okay. Line up the goniometer as best as you can and give that a measurement. Keep your patient comfortable during goniometric testing. Okay? All right.